This morning we are talking about a common topic, but not so common in the sense that it looks like there is more to it than we know. And this morning we are discussing diarrhea disease. And we are all going to educate ourselves one way or the other. So I've been joined in the studio by Mrs. Laura Ajoko Abubakari, and like I mentioned earlier, we are discussing the topic diarrhea disease. And Mrs. Laura,
yes, my
you are welcome.
Thank you.
You look sweet.
Thank you. You're also looking splendid.
Thank you. I see you are still in the whole Ghana month.
Yes, so the previous week has just been a little stressful, but
stressful.
We are good to go.
Oh. Then I was just about to ask you, because how was your holidays?
Break. Yeah.
So how was it stressful? Because it was supposed to be a break.
Well, mine was all about church. We go to church
the convention.
morning, evening, and we close very late.
But it was calm, right?
It was worth it.
You're right.
It was worth it. At least the faith in Christ, He dying on the cross, the resurrection power, and for that alone is enough for us.
Right.
To hold on to Him every day in our life.
Amen. Amen. It's good to have you back.
Yeah.
And this morning we are discussing diarrhea disease. And before we even came on air, I was asking you so many questions about it.
Sure.
But I think it is fair, since I'm very curious, I know my viewers are also curious.
Yeah.
So I hope that you're going to educate us very well this morning. So please, first of all, what does it mean to have diarrhea?
So let's say diarrhea is a very common disease, or let me say it mostly comes like a symptom. It's very common among our Ghanaian society because of the way we go about our foods, our drinks, our environment, sanitation. So that makes it very common, and it's one of the commonest disease that is mostly affecting our young children within the age of 1 to 5 years. It's mostly common among them because they normally play on the ground. You find them picking up things, forget themselves, put their hands in their mouth, infection spreads in, they start having problems with their GIT, and diarrhea can easily set in. Now, coming to what diarrhea actually is more of passing loose stools for over a long period of time. It could be, let's say, more than 3 times in a day. And then these loose stools end up progressing to you losing other fluids of the body and other electrolytes in the body. So the body is deprived of fluids and electrolytes. And that's what normally happens when you start having that loose stools.
Okay. So is it like the normal stomach upsets that we've been getting?
Well, normal stomach upsets can just give you stomach cramps. But apart from that, diarrhea itself, let's say you are passing the loose stools for, let's say, about 3 or more. So let's say 6 times passing loose stools in a day is not normal. So you having just a loose stool just once in a day, it may be just something that you have eaten that has just caused that. But when it's continuous, let's say about 3 or more times in a day, let's say within 24 hours, you are getting more than 3 times loose stools, and you realize some of the symptoms presenting, like having profuse sweating, your temperature is rising, you are having abdominal cramps, it should give you an alert that there is something actually wrong with you that you need to attend to.
All right. So the normal typical example is just the loose stools. Aside that, you don't have any other thing to attest to it or to show that someone is going through something like that.
So that's what I'm saying. The normal thing for you to know that you have diarrhea is you having the loose stool. It's the loose stool that will tell you that I have diarrhea. But there are other things that are also associated with it, the symptoms that comes in play, like the cramps that you'll be having. You'll be having abdominal cramps with pain. Then you'll be having temperature. Some people may have temperature rising. It's not all diarrhea that you see people having temperature rising. You see people vomiting. You see people having nausea. you feel like vomiting, the vomiting is not coming. Some people will be having diarrhea and be vomiting as well. So we have so many kinds of conditions that are associated with diarrhea. So some of them, depending on what is presenting and what is leading or causing the diarrhea, then we would say that you're having diarrhea. But for diarrhea, it is the loose stool that will give you an alert that I have diarrhea.
Okay. So what if you're experiencing the cramps and all the pains, not too much pain, okay, but then there are no loose stools?
So that one could be a different condition, and it is not diarrhea.
Okay.
But diarrhea comes when you have the loose stools. There are things that are causing you or making you have the loose stools. It's either the guts are being irritated by maybe the spicy food you have taken, or the dairy food you have taken, or it's either there is excessive release of water and salts in the intestines and it is not being absorbed, so it will just pass and then give you loose stool. Or it's either you have a problem with your colon and that one will also cause a loose stool to also come. So there are so many things that are associated with you having that loose stools. So you taking in contaminated foods can easily make you have loose stools. Contaminated water can make you have loose stools. So there are so many factors involved that may help or increase the rate at which you have your loose stools.
Okay. And what are some of the things that can also cause you to have the diarrhea?
So let's look at the causes of diarrhea. I've made mention of some.
A few.
Yeah. So there are so many causes. It can either be caused by a virus, and mostly the most common one is the rotavirus. So either a virus causing it, is either a bacteria causing it, and then the bacteria, we can have the E. coli, is also found in the intestines. And then we can have other bacteria too also causing it. Apart from that, we can have parasites that can also, so the bacteria, we can have the E. coli, we can have the Salmonella species, and then apart from that, we have the parasites too over there. We have the Shigella, also part of the parasite. So there are other things that can also cause one to have diarrhea. It could be a medication you have taken, external factors like medication that you have taken. It could be maybe a particular diet you are taking that is stimulating your intestines for you to have diarrhea. Not necessarily an infection, but because you have taken too much spicy foods, your guts are being irritated, so they just flow. So it doesn't allow the intestines to do its work. So it stimulates the place and then the stool will just come. So, you know, some people too, when they take this dairy foods, it's very difficult for them to digest. So it also gives them loose stools. And then they start having diarrhea when they take dairy foods. So there are other factors involved that can make you have diarrhea.
Are there symptoms?
Yes, there are symptoms.
Okay.
There are symptoms of diarrhea. So like I said, symptoms that normally present, first one is when you start having the loose stools. And then subsequently, sometimes you feel the edge of passing stool. And then all of a sudden you realize the stool is just coming.
It can happen like that?
Yes. That's where the diarrhea comes. Then the subsequent ones, we have the abdominal cramps. You start having the stomach pain. Some people will have temperature rising. Some people will have nausea, vomiting, like I said. It varies on what the person is presenting with. So the symptoms does not come to one person at the same time with all kinds of symptoms at the same time. So it could be that one person is experiencing stomach cramps and having diarrhea, but no fever. So that would help the doctor know what exactly to treat. But if you're having fever, you're having the diarrhea, you're having abdominal cramps, then it should also tell the doctor what is happening. If there is fever, meaning that it could be that there is an infection somewhere which needs to be managed or treated.
Okay. And since you've mentioned fever, it looks like fever and diarrhea goes hand in hand. I don't know. But
it's one of the symptoms.
Per what I've heard, it looks like if you have fever, automatically you'll be experiencing diarrhea.
No.
Why is it like that? No, in most cases.
In cases of diarrhea, the possibility of you having fever will be high if there is an infection, because the infection is what will cause a fever to rise or your temperature to rise. Okay. Are you getting it?
Yes.
But in a case where the person is just having a normal abdominal cramps, that one will not, and it's not associated with fever, but will be having diarrhea. There is no fever. Are you getting it? But in a case where there is infection, there can be fever, because the fever would cause a rise in the temperature. Are you getting it?
Yes. Okay. And what are some of the stages that are also associated with diarrhea?
So with diarrhea, I would say that I've explained the stages already. So they have the stages with the osmotic stage, where they have excessive secretion of water and salt in the body. So there is, when we say osmotic pressure, moving from a region of lower concentration to a region of higher concentration. So when it gets to the higher concentration, it comes just like that as a stool. Then it washes over the intestines and then comes out like watery stool. Then apart from that, we have the secretory phase. The secretory phase is where we have the intestines releasing some secretory substances that also stimulates the intestines and causes diarrhea. Then we have the exudate stage, where we have the secretion of mucus, and sometimes there is blood mixing the stools, and then it's just washed down. And then the last phase is where we have the colon having a problem, which also can also lead to the one an individual having diarrhea.
Okay. And earlier you mentioned that foods such as dairy food and salty food can cause you to have diarrhea. Are there more to it?
So we don't have salty food, but sugary food.
Sugary food, rather.
Sugary food can make you have diarrhea.
All right. Okay, you said the salty has to do with inside the
intestine.
Right.
Where I was talking about the stages, where there is excessive secretion of the water and salt in the system, in the intestines, and that also causes that, because it cannot be absorbed by the intestinal walls, so it is easily washed off. So that's one cause of diarrhea. But in the food, the types of food that can cause diarrhea, there are a lot. So we look at sugary foods. Sugary food may not let somebody have diarrhea, but may cause somebody to have diarrhea. The same way dairy food, somebody may take milk and will have diarrhea. Somebody will take needle and will have diarrhea. So it depends on what you are consuming. So somebody taking a dairy food, normally what happens to those who have diarrhea with dairy food is that the digestion of the dairy products does not go well with them. So digestion is being doesn't go on well, and that makes them have the diarrhea. Apart from that, spicy foods. There are people who take spicy foods and their intestines are just irritated, and then they start having diarrhea. Somebody taking too much peppery food, you see all of a sudden, then you start running diarrhea. So that's also another cause. Apart from that, people taking medications. There are some medications that sometimes you take and all of a sudden you realize you are having loose stools. So they are also there. Some of them, even though it's one way or the other, the drug is helping your system, the other side effect that the person may be experiencing is the diarrhea. So there are other things too that can also lead to that.
Okay. So what happens with the less vulnerable people, like children who experience diarrhea?
So like children, it depends on the age. So let's say children experiencing diarrhea, let's say babies experiencing diarrhea, we will encourage that mothers normally breastfeed exclusively for the period of 6 months. Breastfeed your baby exclusively, and with that you have already built the immune system for the child. So far as the immune system is being built up, the child doesn't have issues with subsequent diarrheas. Do you get it? Because if the child's immune system is already built, the breast milk alone has a lot of things it does for the child. So aside building the immune system, it does help their guts. There are other let me say, other things inside the breast milk that also helps with the guts to be able to sustain itself, to prevent things like diarrhea. Are you getting it? So all of this work hand in hand and help the child to be able to have good built immune system to be able to withstand some of this diarrhea condition. So children who are not breastfed within a period of 6 months exclusively, they are at risk of having diarrhea in subsequent years, especially in their younger age. And then the children within the age, let me say 1 to 5 years, they having diarrhea will either be associated with the kind of food they are eating or the environment in which they are playing. Poor sanitation can easily make them contract the infection. So they can easily contract cholera and other things, which will also lead to diarrhea. Are you getting it? Apart from that, they also taking in contaminated food, contaminated water can also easily make them prone to having diarrhea.
Wow.
Yes.
So I'm just thinking about what you said earlier,
yes,
that sometimes it doesn't even come with a notice.
No.
It just happens.
It happens.
So with children who are not able to like walk, like toddlers, or it doesn't happen to toddlers.
So it happens. It happens. So sometimes even when you are not breastfeeding exclusively and you are doing other feeds, sometimes the way they care for their cups or they care for the things that they use in preparing the feed alone can lead to the child having diarrhea, because there will be contamination of the feed that you are going to give to the child. So even though the child is a toddler, feeding the child and not keeping your items in a clean state can easily make infection set in and the child will start having diarrhea.
Okay.
Yes.
Now let's talk about some of the treatments when it comes to diarrhea.
Okay. So let's with the treatment, it varies. So depending on what is causing the diarrhea, you'll be managed with it. But let's look at the home management. So from the home, when your child is having diarrhea, we normally have first aid medications that we do administer, and health education has gone worldwide and has made mothers inclined with what to do as to when their children are having diarrhea at home. So one is taking a lot of water. Taking a lot of water will help rehydrate the system and wash out all the things that are causing the diarrhea to occur. Now, apart from that, we have coconut water. It's also very good because it will help rehydrate the system. We have water, rice water, which you can just cook the water at the surface of the rice water, or you can just consume rice. Rice is also good to help stop diarrhea. Bananas are also good. We have apples are also very good. Yogurts are also very good in managing cases like diarrhea. Apart from that, if you don't have all of this, you can get your Coca-Cola bottle, you get your water in it, add a little salt, add a little sugar, and then you have your ORS, which you can also take. Aside that, we give zinc tablets. The zinc will also help to prevent the diarrhea or to reduce the free flow of the stool. Are you getting it? So these are the home management that I can talk about. Now, when we come to the hospital, we give IV infusions because the person has lost a lot of fluids. So the infusions that we give also helps to rehydrate them because they contain salt. We have normal saline, which contains salt and water, and then we have Ringer's lactate. It also contains a lot of electrolytes in them. Apart from that, we will give you maybe DNS to just revive you because it has a little sugar to give you the energy to be able to sustain yourself. But the most important ones that we do give is the normal saline and the Ringer's lactate. So when you come, we rehydrate you, we give you a lot of fluids to wash the system so that If there are any contaminations, it will be washed off. If there is any poisoning, it will be washed off the system. Apart from that, you are being either administered any antibiotics to treat or manage it. Some people use Imodium, which is the loperamide, but that one, it can only stop the diarrhea. It doesn't treat the infection. If there is any underlying infection, it's not treated by the Imodium that most people normally take during time of having diarrhea. So what our advice is that when you are having diarrhea, don't just be taking Imodium from the home. You need to know what is actually causing the diarrhea. So from there, we know how to go about the management. Some people give flagyl, but it depends on what is causing the diarrhea. We administer flagyl. Depending on what is causing the diarrhea, you can give ciprofloxacin, and sometimes some also give azithromycin. So it depends on what is happening to you. When the doctor knows what is actually causing the diarrhea, then you are being administered the right medication that you need to take.
Okay, and what are some of the impacts that diarrhea also has on the body?
Well, diarrhea can have so many impacts on your body. Now, so far as you are losing body fluids, there is imbalance in your body. So the body is no more in a hemostasis stage. So the body has lost so many fluids. You are prone to having dehydration. So your skin will also be dehydrated. Your whole body, you'll be having either sunken eyes, you become lethargic. So there are other symptoms. Apart from that, some people may be having blood in their stools, which is very dangerous because we are not expecting to see blood in a stool. So if bloods are coming in the stool, which is dysentery, what is happening to the body? Because you know, as and when you have the loose stool, you have the edge to push. So you are pushing everything down. Sometimes you go and nothing is coming, but you still have the edge to push. So all of these things are things that affect the intestines or the intestinal walls. So there are so many things happening in there. So there, like I said, with the exudates, there will be secretion of what mucus and sometimes blood, which will mix with the stool and then it will come. So you realize that the person is either having blood also in stool. So these are some of the dangerous things that normally occurs when people start having diarrhea.
Okay. And what is the worst case scenario when it comes to diarrhea?
The worst case, you can easily die because if the body is mostly made up of fluid. Our body has, let me say about 60%. So if your body fluid has been lost, and the fluid in the body is not only water, it has electrolytes in them. There are potassium in the fluid, there are sodium in the fluid, and that is what sustains us. So if you have lost all this water from the body, you have lost all these electrolytes that keeps the body moving, then you are losing everything. So you can imagine what is happening to your body. And there is imbalance in your body because this same fluid that also helps in blood formation. It forms part of your blood. It forms fluid coming out of your body. It forms part of your sweat. It forms part of your urine. So if all of this fluid are being lost, which one is going to help in the blood formation? Which one is going to help in urine formation? Which one is going to help for you to even excrete sweat? Do you get it? So the body is being deprived of fluid, then meaning that you are losing everything. And the possibility of you dying out of dehydration alone is very high.
Mrs. Laura,
yes.
What advice do you have for my viewers today regarding the topic?
So for our viewers over there, diarrhea is a condition that is mostly found among our Ghanaian society here because of our poor sanitation, because of our contaminated waters, because of our contaminated foods. And one thing we have to mostly look at is the kind of food you eat, because you buy from the vendors, these particular vendors, most of them have not been treated. You know, ideally they should go under screening and get a screening done vividly before they even go out to say I am selling food. But here in our Ghanaian society, everybody wakes up and they're selling food. the risk at which you are prone to having cholera, typhoid, and all other conditions that may lead to you having diarrhea is very high. So we should be more cautious about what we eat and where we buy our foods. Make sure that where you are buying your food is a very clean environment, and ensure that the food you are going to consume is well washed. Proper hand washing is one key. Washing your hands with soap and the running water. When COVID came, everybody now was learning how to wash hands with soap and the running water. But now, go back and ask if people are practicing it. It is gone. But when you go outside Ghana, people are more cautious about hand washing. And hand washing practice is one key, because everything you touch goes through the mouth. And everything from the hand goes through the mouth. If it's not the mouth, it's going through your nose. Because you might forget, and then the next time your hand is in your nose, you have already contaminated yourself, or you've infected yourself one way or the other. Proper hand washing is most key. And then good sanitation will help us. So make sure your environment is always clean, so that your children will have a good playing grounds for them. Make sure you mop your surroundings, because they pick these bacteria from the grounds. So immediately they pick it from the grounds, it goes through the mouth, and they already have diarrhea. So ensure that you do hand washing for the kids, and ensure your environment is very clean. Check what they are eating. Inspect the kind of food they are taking. Inspect the kind of drinks they are taking. Because even the water, tap water, is not good for us. Make sure that the water they are taking has gone through the normal processes it has to go through, and it is safe for drinking before you make them have it for themselves. Okay. So we should keep ourselves clean. We should wash our hands. We should eat healthy diets. Drink a lot of fluids. If you realize you're having diarrhea, there are the homemade remedies are there. Taking a lot of fluids, taking a lot of coconuts, a lot of rice water. You can do your own ORS in the house, oral rehydration therapy, by getting just a bottle of Coke, put in water, clean water I mean, put in a little salt, add a little sugar, and you are good to go. If you realize that there are things that makes you have diarrhea, like you taking spicy food, you taking dairy foods, you taking, some people even take kontomire and they have diarrhea. So maybe the iron in it alone is not good for them. So the things you realize gives you diarrhea, avoid them. Okay. And take healthy diets that will help you prevent all this occurrence of diarrhea around your surroundings. So for my viewers, this is a little gist I'll give to you. Practice your hand washing.
This is a lot of gist.
Yes. The key is the hand washing practice, and then ensure your environments are clean. Eat good food, and check what you inspect Inspect the food you are going to consume. Okay. Because it may lead to diarrhea if you are not careful.
All right. Please, your social media handles.
All right. So you can reach me on my WhatsApp line 0261 668390, or you can reach me on my Facebook, Laura Tewia on Facebook, or you can find me at Mana Mission Hospital, the labor ward precisely. That is where you can find me. And my midwives out there, they say I don't normally mention them. My midwives out there, I always say that they are doing good work, so they should keep it up. Keep giving our clients the education that they need, because education is the key. If we are not educating them this way, they might end up losing it. Right. And they losing it, we lose them as well. Right. So losing them as well, we wouldn't like it to happen that way. So we are grateful to have them also. And I want to say thank you to everybody too.
Right. And thank you for coming.
Yeah.
We are always happy to have you here.
Thank you so much.
And this morning we got educated on diarrhea disease by Mrs. Laura Ajoko Abubakari, and she is a midwifery officer or a midwife. Thank you so much for staying with me throughout the health segment or the well-being segment. I still have more for you right here on the show. I'll take a quick break. I will be right back.